Okay, let's go.
Have you ever wondered what it means when your body feels out of sync as a woman? You might have heard of menopause, but what if these changes start happening much earlier than expected? Premature ovarian failure, also known as primary ovarian insufficiency. It's a condition that affects many women, often going unnoticed until it becomes a significant concern. In today's video, we're diving into the 10 symptoms of premature ovarian failure that you should be aware of. Understanding these signs can help you take control of your hormonal health and seek the right medical advice early on. Premature ovarian failure, POF, also known as primary ovarian insufficiency, is a condition where a woman's ovaries stop functioning normally before the age of 40. Unlike menopause, which typically occurs around age 50, POF can happen much earlier, sometimes even in a woman's teens or 20s. Causes of premature ovarian failure includes genetic factors. Certain genetic conditions like Turner syndrome or Fragile X syndrome can affect ovarian function. Autoimmune disorders. In some cases, the body's immune system mistakenly attacks the ovaries, leading to their failure. Medical treatment. Treatments such as chemotherapy or radiation therapy for cancer can damage the ovaries and lead to premature ovarian failure. Surgical removals. Removal of the ovaries for medical reasons such as ovarian cancer leads to premature ovarian failure. Infections and toxins. I can't say this enough. Exposure to certain infections or environmental toxins can also damage ovarian function. Hormonal changes in premature ovarian failure. In premature ovarian failure, the ovaries produce fewer eggs and less estrogen, a key hormone in female reproductive health. Estrogen plays a crucial role in regulating the menstrual cycle, maintaining bone density, and influencing mood and sexual function. The decline in estrogen levels leads to symptoms and health risks associated with premature ovarian failure. Diagnosis of premature ovarian failure involves a combination of medical history, blood tests to check hormone levels like follicle-stimulating hormone and estradiol, and possibly a pelvic ultrasound. In premature ovarian failure, the hormone that is typically high is follicle-stimulating hormone. Follicle-stimulating hormone is produced by the pituitary glands and plays a crucial role in regulating the menstrual cycle and stimulating the growth of ovarian follicles, which contain the eggs. In premature ovarian failure, the ovary's ability to function properly is impaired, leading to a decreased production of estrogen and other hormones. As a result, the pituitary gland increases the production of follicle-stimulating hormone in an attempt to stimulate the ovaries to produce more estrogen. Elevated levels of follicle-stimulating hormone in the blood is a key indicator of ovarian insufficiency and is often used to diagnose the condition. Have you done your follicle-stimulating hormone test? What is the value reading? Normal follicle-stimulating hormone levels vary depending on the menstrual cycle phase, but generally fall between 1.7 and 21.5 IU per liter for premenopausal women. In premature ovarian failure diagnosis, follicle-stimulating hormone levels consistently rise above 40. Is an indicator of premature ovarian failure, signaling that the ovaries are not functioning properly and the body is attempting to compensate by producing more follicle-stimulating hormone. So the number one symptom we'll be looking at today is irregular or missed periods. One of the earliest signs is irregular or missed menstrual cycles. This happens because the ovaries are no longer releasing eggs consistently, and the production of estrogen and progesterone becomes erratic. Estrogen and progesterone regulate the menstrual cycle. When these hormones are not produced in adequate amounts, periods become irregular or stop altogether. Hot flashes. Hot flashes involve sudden waves of heat that can cause sweating and an increased heart rate. These are similar to the symptoms experienced during menopause. The drop in estrogen levels affects the hypothalamus, the part of the brain that regulates body temperature, leading to these sudden heat sensations. Night sweats. Night sweats are intense hot flashes that occur during sleep, often disrupting rest. Just like hot flashes, night sweats are linked to lower estrogen levels, impacting the hypothalamus. Vaginal dryness. Reduced estrogen levels can cause the vaginal tissues to become dry and thin, leading to discomfort during intimacy or daily activities. Estrogen helps maintain the thickness and lubrication of the vaginal tissues. When estrogen levels drop, these tissues lose their moisture and elasticity. Mood swings and depression. Hormonal changes can significantly affect mood, leading to symptoms like mood swings, irritability, or even depression. Estrogen influences the production of serotonin, a neurotransmitter that regulates mood. Lower estrogen levels can reduce serotonin production, resulting in mood disturbances, difficulty sleeping. Insomnia or disrupted sleep patterns can be a result of hormonal imbalance. Estrogen and progesterone plays a role in regulating sleep. Their decline can lead to difficulties in falling and staying asleep. Decreased libido. A reduction in sexual desire can occur due to hormonal levels affecting the reproductive system and overall energy levels. Estrogen and testosterone influence sexual desire. A drop in these hormones can lead to a decreased libido. Difficulty concentrating. Brain fog or trouble concentrating can occur due to hormonal fluctuations affecting cognitive function. Estrogen supports brain function, including memory and concentration. Lower levels can impair cognitive abilities. Infertility. Difficulty conceiving is often a significant indicator, as the ovaries are not releasing eggs regularly. The decline in estrogen and progesterone disrupts the ovulation process, making it hard to conceive. Bone loss. Reduced estrogen levels can lead to decreased bone density, increasing the risk of osteoporosis. Estrogen helps maintain bone density. When estrogen levels drops, bones can become brittle and weak. Being aware of these symptoms can make a significant difference in managing premature ovarian failure. If you recognize any of these symptoms, it's crucial to consult your healthcare provider for accurate diagnosis and appropriate treatment. Your health is in your wealth, and your understanding of your body is the first step towards taking control. Don't forget to like, subscribe, and hit the notification bell for more insightful health content like this. He wish above all things that you and I prosper and be in good health, even as our soul prospereth. Thank you for tuning in today.